welcome to this Children's Nursing Development Unit Journal Club session. A particular warm welcome to anyone joining us for the first time today. Are you watching alone or have you gathered with a group of colleagues? If you're not with others today, maybe consider gathering a group of colleagues next time and so that you can answer and consider the questions given at the end of the presentation together. You might also be interested to know that our full range of past journal clubs are available through our website. You can see the link here on the screen, so go and have a look and see what you can find. You might find an article that's of particular interest to you and your colleagues for your clinical setting. But for today, let's get going. The topic of this month's article is pediatric oncology, and the journal article title is A Qualitative Study of Ghanaian Pediatric Oncology Nurses' Care Practice Challenges. It was written by Nook Peza et al. And published in the BMC Nursing Journal in 2021. It is reporting on a qualitative study that held interviews with Ghanaian oncology nurses so to better understand the challenges they face when caring for children with cancer. It's possible this topic evokes feelings of sadness or discomfort, and I'm sorry for that if it does. Let's start unpacking the article by first looking at the background section. The researchers share that cancer is one of the leading causes of death amongst children and adolescents worldwide, with approximately 300,000 diagnoses per year. They describe how the speciality of pediatric oncology is particularly intense and how nurses often develop intense personal relationships with their patients and then are faced with their suffering on a daily basis. In addition to this, there is a safety concern in the speciality related to the hazardous use of chemotherapy. For those nurses working in lower and middle income settings, this might be particularly impactful since it's there that they have generally fewer resources, which ultimately affects the quality of care that can be provided and potentially the children's outcome. Examples of this less resources include reduced available technology, inadequate education, and increased psychological distress. In Ghana, the authors describe how nurses are the healthcare professionals that are least satisfied with their work, listing remuneration, poor career development, and the work environment as key factors, in addition, as I mentioned, to the poor chance of survival of their patients to whom they provide care. No previous studies have explored these issues specifically in the Ghanaian setting, and so the aim of this study is to explore and understand the challenges that pediatric oncology nurses experience when caring for children with cancer in Ghana. So what did they do? What was the research method? The article tells us that this study used a qualitative exploratory design. Qualitative means that it focuses on gaining descriptions, meanings, and tracking experiences, and the data collected is usually non-numerical, i.e. it's rather words or images or observations. The exploratory part means that the researcher didn't yet know much about the topic, but wanted to explore it more deeply to gain a better insight. It is described in the article how the data was gathered by interviewing the nurses, and they used what is known as purposive sampling to choose who they interviewed. Purposive sampling identifies and selects participants that have the characteristics and experiences that are most relevant to the research question or the research aim. In this case, they wanted nurses who worked at the Tamale Teaching Hospital, and you can see a little bit more about the Tamale Teaching Hospital in the blue box, and those who had greater than 2 years work experience and were willing to share their experiences. All the interviews were conducted by the researchers in a private room and were audio recorded so that they could be re-listened to again. The interviews were held between August 2019 and April 2020 and each lasted 45 to 60 minutes. The interviews were described as being semi-structured, meaning that the researchers had some broad general questions that they then focused down on. The questions they used were, can you please tell me about your thoughts and feelings about your work of caring for children with cancer? And tell me about the challenges you experience when taking care of children with cancer. These were then followed by more probing questions, such as, could you describe what you've just spoken about more, please? In terms of the data analysis, the authors describe how the interviews were first transcribed verbatim, which means that every word that was spoken is then written down, and then they were analysed using content analysis. This means essentially that every interview was listened to a few times by the researcher, and then meaning units relevant to the aim of the study were identified from what people had said. These things called meaning units, which essentially are phrases that were spoken by the nurses, the participants who are interviewed, are then classified into categories and subcategories. Just for interest, it's important to know who was interviewed in the end. Overall, 14 interviews were held, 9 of whom were with males and 5 were with females. 11 had a degree and 3 had a master's qualification. And of the 14, 3 had less than 5 years experience, 6 had 5 to 10 years experience, and 5 had greater than 10 years experience. Let's now consider the findings or the results of the study. In the article, they outlined how the data was ultimately categorised into 2 categories, each with a number of different subcategories. Both categories were titled something about constraints. Does that sound familiar to you? The first was administrative constraints and the second was personal constraints. Under administrative constraints, the researchers then had 5 categories, reporting how the nurses described how time-consuming caring for a child with cancer is, how there's often a lack of teamwork or team interest to care for oncology patients, often due to their time-consuming nature, how they don't have the correct equipment to provide the necessary care or to protect themselves from the chemotherapy, how they often feel stressed when tackling the load of work of caring for an oncology patient, and finally, how often they're short-staffed in their settings. Regarding the personal constraints, the nurses reported how they often felt they had a low level of knowledge about working with and caring for children with cancer. They reported how they were fearful of contracting cancer themselves, either from the patients or from the medications. And lastly, they said that they just generally had low motivation, in particular that no external motivation came from the work environment itself. The article then comes to a close with its conclusion, and the authors describe how they believe that this study enabled an in-depth understanding of the challenges faced by Ghanaian nurses working in a pediatric oncology setting. They identified how the constraints act as negative influences on the provision of curative and palliative care in their setting. They advised that there is a need to address these challenges at all levels of the health service, suggesting strategies such as health education and investment in human and physical resources. They think that if this was done, it could improve the survival and quality of life for children with cancer, which would also in turn increase the nurses' job satisfaction. So that's the end of the article, and I advise you now to take a few moments to just think about all that you've heard. What was new to you? What surprised you? What do you think is applicable to your clinical setting? And then turn to the reflective questions for this week. The first question is just as I said. Firstly, consider what you have learned from this article. Was it something about pediatric oncology? Was it something about research? Or was it something specifically about how nurses cope when working in different settings? Then, question 2, think about the possible findings of this study if it was repeated in your clinical setting. If you asked a similar question about the speciality in which you work, do you think the results would be similar? I suspect so. And so, moving on to question 3, identify one of the administrative constraints that they mention and consider how you and your team in your setting currently manage it. And then finally, the 4th question. Think about the personal constraints that they described and think of 2 ways in which you would advise they address them. Draw on your own past experiences. And that's it for this Journal Club session. Thank you for listening. I hope it was interesting to you and you're excited to access the new Journal Club next month. Look out for its launch on our social media platforms. Bye!